So Carly, when did you first discover the Barihab table? How did that come about?
Yeah, I think I used the Barihab mat first when I started at California Rehab Institute. So that was back in 2017. Yeah.
So, what were your impressions? I mean, the first time you used it, were you like, What is this thing?" Or "How does this work? What kind of patient diagnosis can I use this on?" What was that thought process?
Yeah. So luckily at California Rehab, they had them in all of their separate gyms on the floors. So it was accessible to all patient diagnoses, which was great because to answer your question, I was just like, you could literally use this with so like most patient diagnoses that are in inpatient rehab. So, but yeah, it definitely took a little bit of getting used to for all the bells and whistles that it offers. But after, it's not that hard to figure out once you went through like a demo with an employee. So after that, it was pretty like seamless. Um, but it was automatically like so exciting because I worked at other rehabs that just didn't have the capability of putting everything all in one spot, meaning you could do a standing frame, you could just help with sit to stands, you could facilitate just like weight bearing with a number of patients. And then the best part about it, I think, is like if things go wrong, meaning like drop in blood pressure or things like that, you could automatically be like flat on a table versus like being in these other devices like standing frames, for example, you can only get back into the chair that you stood from, or you're stuck in a standing frame in the seated position and you have to like transfer out of it again. I just think it was really cool. I was just like, this is amazing. Every rehab needs it. And luckily they had a ton there. So yeah.
So how long have you been a therapist?
Yeah. So I had been a therapist for like 4 years at that point. And up until then I kind of worked, I always say I worked at rehabs like big, little, and small. Like I worked at like an independent standalone one that had like 60 beds. And then I worked in an in-hospital unit. And those historically just don't have a ton of resources in general. It's just on a floor in a hospital. And then I went Cal Rehab, I call it was like the big one where there was like 100+ bed, like brand new too. So I had a lot of experience with inpatient rehabs, even being as a PT for like 4 years.
So what's interesting to me is, so how do you choose uh, what organization or what facility you're going to work for? What are the things that you look for in a building, let's say, and you're interviewing with the DOR or whoever,
Yeah.
and you're going, "Oh, okay, well, give me what are you looking for that really kind of seals the deal for you?" I mean,
Yeah. For
what are the
me,
important things?
mhm. For me, the important things are that both the patients have the resources that they need, but also that the staff does, like the staff has resources. So that can come in manpower, that can come in the amount of productivity, I guess, expectations they have, or the equipment. And so those are things that I really look for whenever I'm interviewing to work for a place, because my longevity is part of the equation as well. So,
Yeah, how long can you continue to work, right?
right, exactly.
Um, Injuries to therapists, clinicians in general, healthcare workers in general. I think a lot of people are unaware of how often an injury can occur and how they can occur.
Yeah,
It's not always just a one-time thing I did wrong and now I'm injured. It's the repetitiveness of doing the same thing over and over again, day after day, and that'll wear you down as well. So
yeah,
it's not just one thing.
correct. Yeah. And I think also as physical therapists, as much as we know how to use proper body mechanics and all the things, like we also care so much about our patients. And if we are oftentimes doing too much if we don't have the resources to do it. You know, dependently walking some hemi, dense hemi strokes is like something I
Right.
definitely did. And I don't look back and regret it, but it was like it's hard on your body. And so, but you want to get these people and like the goal is you have such finite amount of time and it's getting shorter and shorter and shorter how much time they can spend
Right.
in
Right.
these facilities. So you don't want to waste any of their time. And so the amount, the help that your mat specifically can provide is just like getting people weight bearing, especially very low level strokes, brain injuries, spinal cord injuries. They are really, really benefiting, I think, from the standing frame capability of it.
Hmm.
Um, and and I think that's the biggest thing because I can get someone who has almost like no muscle control standing by myself.
By
So
yourself.
it's pretty
Exactly.
wild.
Yeah, that's the beauty of it, you know. I think that have you experienced where a therapist uh, has less anxiety and more confidence to do things with a patient because a piece of equipment is actually supporting the patient, the therapist isn't supporting the patient. So you know you may want to do more, try more, and accomplish more, you know, in that environment where you've got a piece of equipment that you can rely on to provide the safety and all of that.
Yeah, for sure. Like I said, the resources whenever I look at places like manpower. So if I had three people helping me stand someone, I'd be very confident. But if I had that same patient scheduled and I didn't have the manpower to do it, it wouldn't happen. Or I know I'd pick a different intervention that likely wouldn't be potentially as effective. So yeah, having this piece of equipment is like having like three sets of hands, which is pretty.
Yeah, yeah. Do you think the patients feel more secure? And if they feel more secure, does it translate into less anxiety, less fear, and then do you think that they're willing to do more because they're less anxious and less fearful?
That's a good point. And I would say probably it does take some convincing because, like I said, as much as I don't prefer to stand someone dependently with like a dense right-sided stroke, I can, but they look at me and they're like, you can't do this. So
Right,
sometimes I take it as a challenge, but they will for sure hesitate and not move as appropriately also. So I think
right,
when people aren't confident in your ability, then not only are they more willing to participate, but they also will move more appropriately and safer on their end as well.
right, right. Now, when you go to work someplace in their therapy department, do they have an ergonomics program or some sort of manual that you look at and you go, "Oh, okay." Is that common or
Um,
is that unusual?
well, my assumption is that they would probably assume that we are the ergonomics experts, so the need to like orient a provider that way isn't
Right,
top of mind. So what if it is? I've seen it as part of because again, I've oriented to like four different rehabs now. They do have it as part of their onboarding in a couple of places. I will say it's oftentimes maybe something that does not get highlighted as much with therapy staff versus nursing staff. And if there's like less time, because orientation is also laid out in this pretty little timeline and handbook, but as we know, getting you to patients is the goal. And so some things do get cut out. And I think that that
right,
oftentimes gets cut out. So at least in the therapy department, because again, we should know and we do know the appropriate ways to do things.
right. Well, I've heard it said that you know, ergonomics programs are great, but you can throw it out the window when you're working with another human being because they're so unpredictable. You
Yes.
can't predict what happens one way or another.
Yes.
And if that patient is going down, you're going to sacrifice your body to
Yeah,
keep that
for sure.
from falling, correct?
100%. Yeah.
Yeah, yeah. So So the equipment really kind of matters. Not only our equipment, but all equipment.
Yeah.
Hoyer lifts,
Mhm.
other standing frames.
Yeah.
Um, and our goal in the beginning was to try and eliminate transfers
Hmm.
because we know that most injuries occur during a transfer.
Right.
So the thought process is if we can eliminate the need to transfer, we can reduce the risk of injury.
Yeah.
And that was our goal.
It's interesting that you say that, and it's definitely like a good starting point, but you actually make it possible for people to practice transfers more. So we
Really?
in the rehab setting, we want patients to put in the repetition of
Right,
practicing sitting, standing, turning, or sideboard transfers, doing them at varying levels. So that's what a normal mat, adjustable mat could provide. But you also have some ways to like put the poles up where you can practice, like if people have grab bars at home, things like that. So
right,
it's another thing. So that might have been your initial goal, but I will say in rehab, we use it frequently to practice transfers.
right. Because they're going to have to transfer when they get home, right?
Yeah, right. Hmm.
So one of the things that we developed is called a quick start program. And
Hmm.
that quick start program really focuses on three types of transfers. Transfer to and from a commode,
Hmm.
to and from the bed,
Hmm.
and to and from a car.
Right.
So if that patient can do those three transfers, then they're a candidate to be discharged and go home.
Yeah, right.
Is that correct?
Those are the big ones. Yeah, I would say.
Those are the big
Yeah,
ones. Yeah. Well, taking care of your own hygiene is probably the biggest.
yeah. It is the biggest. I will say that's the one that insurance cares the least about. So,
Really?
um, they want to make, yeah, I mean, if a patient was very mobile or family could take care of them in all other aspects of their life, but they couldn't get to and from a toilet or manage their own toileting, then I don't think it gets covered. Yeah, those kind of hygiene things are not what insurance is looking
Right.
for. Mhm.
Well, I think the other part of the Barihab equipment is really focused on providing a way that seniors can continue to go from a sit to stand.
Yeah,
Because once you lose your ability to go from sit to stand, a big part of your independence is gone.
yeah,
And
yeah,
so maintaining that muscle strength, a lot of people think, oh, you know what, you can walk, right? Which is great. You can ambulate, but you have to be able to stand first.
yeah,
And standing is more difficult than walking. It
yeah.
takes more leg strength.
Mhm.
So that whole sit to stand idea with the Barihab, with the seat lift,
Mhm.
helping the patient
Yeah,
when they need that, and the table height
yeah.
uh, really, really
And,
works.
and also that all those things accommodate bariatric size patients as well.
Are you seeing larger patients?
Yeah, yeah. When the hospital has the equipment to accommodate them, I don't, there in certain rehabs, there's definitely not um, the same population. There, I think the general population is heavier as a whole, but for the
Right.
bariatric sides that really need like the beds and the Hoyer lifts and mats. I've worked at those facilities that, they're definitely there. And it's interesting. I mean, a lot of them actually are stronger than you think, but it is the confidence piece of like,
Right.
what if something does go wrong or if they sit here, so having the equipment available is necessary for sure.
Right. When you see a patient, I find this interesting. When you see a patient that's 250 pounds, 200, 300 pounds, you know you're going to need help transferring that patient. So you gather around as many people as you can to make that transfer as safe as possible.
Mhm.
But when you see a 90-pound geriatric patient, you have a different view, right? But the fact is that that 90-pound geriatric patient is somewhat even more dangerous to you because you're not registering up here that this is 90 pounds is heavy, right?
Yeah.
Anyway, any way you look at it, lifting a 90-pound weight, whether it be a human being or a sack of cement, is
Yeah.
heavy.
Well, and the goal is also for the patient to do as much as they can on their own. So even if I am looking at a 90-pound patient who's a dependent transfer or a dependent sit to stand, the goal is for them to do those as much as they can on their own. So, I mean, it,
Right,
it still comes in handy because we can adjust the height where we start practicing from and
right,
things like that. Versus, I've been in rehabs where it's like, okay, this mat doesn't go high enough, or some I can't block their knees in this situation, and but I can do it in the parallel bars, but I want to be out of the parallel bars. Like there's just a
right.
lot of things that come into play, and then you're kind of grabbing things that are a little bit questionable, like it's all safe. Like we would never put someone in an unsafe position, but you're also like, well, let me pad it up with this yoga block and this other thing. And I worked with the brain injury population a lot too. And I also enjoy the Barihab for like the seat function, because the back rest comes up like before you,
Right.
so you can do a lot of things with just like core exercises by using that. You can get into tall kneeling, like especially a lot of these more mobile, like traumatic brain injury patients can kind of like get into quadruped or in tall kneeling and use that to kind of work on um, balance and core work and all the other things without having to grab like wedges and other pieces of equipment that do help, but they're also, you need, it just becomes this like piecemealed thing that you put together. And sometimes the equipment's not available and sometimes it is. And just kind of throw
Right.
the communicator off if you walk into the gym and someone's using the rainbow and I can't use that, but I want to do this.
Well, that's one of the things that we've heard from a lot of facilities that purchase a Barihab. They put up a sign-up sheet.
Yeah.
Well, I'm using this piece of equipment from 10 to 10:30.
Yeah.
Okay. And then, then you can have it. And that way it's, coordinated a little bit better.
Yeah.
Obviously I always suggest, well, maybe you need another Variab.
I would
But
say, I was going to say that my first introduction was a facility that had them on every floor. And I would go to different floors because we didn't have a sign up sheet because there was so many. So we would just be like, oh,
right.
I'll go to the next floor and use it there. But I will say it was used on every floor. So therefore used for like when you ask for diagnoses, like it can be used for like every diagnosis. I will.
Yeah. Yeah. And that makes us feel good because uh, we want to make a difference in the lives of patients and therapists.
Yeah.
Because
Yeah.
you got to partner together
Yeah.
in order to achieve the best possible outcome, right?
Yep, for sure.
But that's the big deal. So what's in the future for you now?
Yeah, I've kind of pivoted from inpatient neuro rehab to I do pelvic floor physical therapy. So I started my own business doing that, but I do PRN uh, inpatient rehab still here in Nashville. Um,
Uh-huh.
so right now it's a little bit of both. I don't know for sure what my future has because I didn't think I would be starting a pelvic floor physical therapy business. So that's for sure.
Well, you know what? It's just great to talk to you and just to get your perspective on therapy in general, and then therapy that you've experienced with our product.
Yeah.
And we just appreciate all your input and appreciate all that you do for the patients you come in contact with.
Yeah.
And man, we wish you the best of luck. We we want to help.
Well, thank you. Well, I wish you guys best of luck. I think any new rehab I go to, I'm just like, if you guys are getting a new mat soon, you should probably get this mat. So don't stop talking about it.
I'll send you a bunch of brochures, okay?
Okay, awesome. Sounds good. I'll pass them out.
All right. Well, thank you.
You're welcome.
Appreciate your time.
Yeah, have a good day.